Good day. Today I will present Flexpen and Tuberculin Syringe as an output for drug delivery systems. This is Group 2's presentation and I am Harvey Rapinan presenting. Table of contents. Number 1. Its name and illustration of the devices, how it looks like. Number 2. Brief description of its parts, a definitive function of the drug delivery system, and their applications. Number 3. A stepwise manner of actual use of the device. Fourth is the counseling or additional information provided for patients who are using the device. And lastly, new device research, which is antibiotic bone cement. So number 1, Flexpen or Novo Rapid Flexpen. 100 units. It has 100 units per ml. It is a solution for injection in a pre-filled pen. It is also used for insulin injection. It looks like a highlighter or a pen. That is why it is called Flexpen. Description of the parts and definitive functions. Here are the parts. As you can see, there's a cap, a reservoir, and needles. So first is the pen cap. It acts as the cover of the needle of the pen. The rubber stopper prevents the excess fluid of the drug to flow outside of the needle. The cartridge, it is the reservoir of the drug. The cartridge scale acts as the measuring instrument to determine the amount of drug. The pointer determines the amount of dose to be injected. Dose selector, an adjustable part which determines the dose of the drug. And a push button, a mechanical part of the pen that is used to release the drug to the skin. Here are the application of Flexpen. It is for diabetes mellitus, DM. It is a rapid-acting human insulin analog indicated to improve glycemic control in adults and pediatric patients with diabetes mellitus. Or in other words, it is an injection for insulin, for taking insulin. Next is the demonstration part, where we show the stepwise manner of the actual use of the medical device or the Flexpen. Number 1 is to roll the pen and move it up and down 10 times to thoroughly mix the insulin or the drug. There, sometimes the insulin has a cloudy appearance, so you have to mix it in order for you to have the maximum therapeutic effect when administering it. Number 2, you have to remove the cap and insert the needle. Take note that the needle should be new. Then calibrate the pen to the desired amount of drug dose by using the dose selector. See to it that it is the right dose. Number 3 is pinch the skin of the patient, then inject the pen 90 degrees. Press the push button or the mechanical part of the pen at the back part to release the drug and retain the needle for 6 seconds before removing. Number 4. Remove the needle, then place the cap. Store it on a refrigerator for the next use. You cannot reuse the needle once used, and you have to store the insulin on a refrigerator. Here are some counseling advices for patients or additional information addressed for the patients. Number 1, you have to inject Flexpen 3 times a day. Also, it must be injected before meals, so immediately before breakfast, before lunch, and before dinner at the abdominal area for better absorption in a circular or lateral rotation manner. Next, if you forgot and you realize that you did not take 1 to 2 hours from the time you should take it, it will be fine to inject it immediately. Remember, 1 to 2 hours. But if you miss an insulin injection after 1 to 2 hours, you should skip it and take it before the next meal. Remove the needle from the Flexpen after each injection. You cannot reuse a needle. Be clear when handling used needles to avoid needle sticks and transfer of infectious diseases. Do not share your Novolog, Flexpen, or needles with other people. You may give other people a severe infection or get a serious infection from them. Remember that you should always dispose of a needle after use. And use Novolog, Flexpen as directed to treat diabetes, nothing else. Always use a new needle for each injection. And remember to keep the disposable pen with you. Do not leave it in a car or other location where it can get too hot or too cold. It may alter the insulin or may damage the insulin or the Flexpen itself. Lastly, you need to keep it away from children. Next medical device that we will be tackling is Tuberculin syringe. This is how it looks like. It's like a normal syringe. Next is the description of the parts and its definitive functions. Tuberculin syringe is like a normal syringe with barrel, plunger, cup, and needle. The barrel is used as a reservoir, or it holds the drug solution and is marked with lines for calibration on the side. The plunger is used to draw the drug into the barrel or push the drug out of the barrel through the needle. The next is cap. It serves as a lid or a cover to maintain the needle and its contents. Next is the needle, made of a special material that allows the needle to slide through the skin easily with less pain. For the application, it is mainly used for tuberculosis, as the name suggests. Tuberculin syringe, tuberculin, tuberculosis. An example is tuberculin purified protein or tubersol. It is a glycerol extract of the tubercle bacillus used for tuberculin skin tests. Tuberculin is a PPD or purified protein derivative. It is commonly used for tuberculosis testing or TB tests or diagnosing tuberculosis. Now for the demonstration of the tuberculin syringe or the actual stepwise manner on how to use the medical device. Number 1, if you have cloudy drug, gently roll the bottle in your hands or rotate it from top to bottom in order to mix it. The drug is usually contained on a vaccine bottle or is called vial. and you have to mix it in order for the drug to be at use on its maximum therapeutic effect when being administered on a patient. Number 2. Pull the plunger back to the number of units needed, drawing air into the syringe. Number 3. Insert the needle in the bottle of the drug through the rubber cap, as you can see on the image. Number 4. Inject the air from the syringe into the bottle and turn the bottle upside down with the needle in it. Number 5. Make sure that the tip of the needle is fully submerged in the drug as you pull the plunger back to the correct number of drug units. And number 6 is how you administer it on a patient. Inject it at a 5 to 15 degree angle, hold for 5 seconds, then pull the needle out, and dispose the needle properly to prevent any harm to others. You cannot reuse another needle. You cannot reuse your needle, And the administration of this drug should be at the forearm. Now, there is a technique in administering tuberculin syringe, and it is called Mantoux technique. It is typically performed on the inner forearm and creates a bubble of liquid that is eventually absorbed by the body. Next is for patient counseling. Now, first is Tuberculin is indicated for intradermal injection only. This talks about the drug Tuberculin. I repeat, intradermal injection only. Next is inspect for extraneous particulate matter and or discoloration before use. If these conditions exist, do not administer the product using tuberculin syringe. Now, you have to check the product first before administering it to the patient because it may cause harmful effects to the patients when being administered. Number 3, use a separate syringe and needle for each injection to avoid infection. Now you have to always dispose of a needle. You cannot reuse a needle. Dispose it after use. Number 4, physicians should review the patient's immunization history for possible sensitivity to components of Tuberculin. In this way, the physician would recommend another drug or another way to test if the patient has a tuberculosis or not. The healthcare provider should inform the patient of the need to return for the reading of the test. Self-reading or self-interpreting of the tests has been shown to be inaccurate and really unreliable. Not all person has the knowledge or has the medical knowledge to interpret a result. Number 6, reporting results only as negative or positive is not satisfactory. Remember. Next is the new device research, which is antibiotic bone cement. What is antibiotic bone cement? It is one of the new devices that are widely used as a treatment for indications such as microorganism-infected joints due to total arthroplasty. Now, for its functions, it is used for treatment of infected bone joints, arthroplasties, also for prophylaxis in total joint replacement. Infections like these are most likely characterized by the formation of biofilms caused by staphylococci such as Staphylococcus aureus and Staphylococcus epidermidis. Next is, it is utilized as a prosthesis fixation to minimize the rate of joint infection. Its prophylactic use is intended for the pathogens expected at the site of prosthesis, which prevents bacteria from colonizing the surface of the artificial replacement. Also, it is efficient and appropriate for the infection in the bone tissues because the addition of antimicrobial agent to bone cement decreases the mechanical properties and is correlated to the quantity of antibiotic added and the homogeneity of the preparation. However, the elution of antimicrobial agent depends not only on the properties of the bone cement but also on the amount of antibiotic that is incorporated in it. But this therapy must be accompanied by surgical debridement backed with systematic therapy. And on top of that, its validity is still used in debates and researches. Next is its benefits. It possesses a broad antibacterial spectrum that includes gram-positive and gram-negative organisms. Next, due to the utilization of antibiotic-containing cements, risk of infection can significantly decrease. Next, it can also decrease the rate of developing antibiotic resistance. It has higher antibiotic concentration compared to other concentrations. It is inexpensive, have low complication rates, easy to use, implant and remove, and longer period minimum inhibitory concentration. That is all. Again, I'm Harvey Rapinan, presenting for Group 2. Thank you.